Hello and welcome to this video on how blood donations work. This video will go through the major steps in donating blood and how it is processed before the hospital or care service receives it in a simplified manner. Blood is used in 22 medical products, from transfusions and clotting packs to supporting cancer patients. One donation can be used to create up to 4 of the 22 unique products. It begins with a donor. They are nearly always healthy adults. They have made an appointment for this procedure, and most blood services require an appointment, as they must have adequate equipment and staff on hand. Before arriving, you should consume about half a liter of water and as much again before beginning the donation. Once in the clinic, you will undergo an ID check. This ensures traceability and accountability of the donation. You will be asked a series of questions about your travels and personal history. In particular, anyone who has travelled or lived in the United Kingdom between 1986 and 2001, which had a problem with mad cow disease. These questions will identify if you are eligible to donate and if the service needs to conduct specific tests on your blood. They will print off a series of stickers that are barcodes associated with your profile and go on everything thereafter. This ensures that what you've donated remains anonymous for the purposes of the person conducting the test, but that the service can trace where it came from. After this is done, the nurse or phlebotomist will take a lancet and prick your finger. They will then use a small light spectrometer and measure the amount of hemoglobin in your blood. Hemoglobin is the blood-carrying protein molecule in red cells. If this is above an acceptable range, you will proceed to a donation area, where you take a seat in a large chair. Once seated, they will clean your elbow with a sterilizing agent such as ethanol, iodine, or a proprietary product. This will often be left on the skin, but some services remove most of it with a swab or gauze. They will then insert a cannula, which you may know as an IV, although that is not quite correct. Once this is inserted, most services will then collect a series of blood samples one of two ways. Either they will connect the collection bag with a separate sample part, or they will draw a series of sample tubes. Generally, there will be 3 to 4 of these taken. 2 are for the blood service to test immediately or at their central collection point, 1 backup, and another for the hospital or care service. These will be used to test blood type, communicable disease, parasites, and more pathogenic elements. The collection bag will then be placed on a rocking plate. This keeps the blood moving and prevents clotting. This is supported by the use of sodium citrate, which prevents the blood from clotting. The line in will be connected to the cannula. This will begin drawing out blood. This will be weighed as it goes along. The weight is used to decide when to shut off the draw, which is calculated from your height and weight. After this, you will be advised to wait around the facility for about 20 minutes, drink something, and eat something. Overall, this will take you about an hour in total to donate. After you have donated, the blood bag will be refrigerated and eventually shipped to a central testing location. Once there, they will do several things. The first is to ensure blood type, hemoglobin, platelets, and so on are correctly matched to the barcoded profile. In theory, your blood type, such as AB, A, B, or O, negative or positive, should be easily tested. They do so using a single slide, a reactive antibody, and a few drops of your blood. The blood will then be spun into three major component categories: red cells, platelets, and plasma. Red cells are transfused with saline to provide red cells for those with anemia. Plasma products are called cryoprecipitate and helps with blood clotting. Then you have your platelets, which help with other pathologies. In this process, they remove any immune cells, which ensures there is no autoimmune or immunological reaction to the donation. There are 12 common tests for pathogens. A full link to these by the American Red Cross is in the description below. Some of the more relevant are HIV, syphilis, and hepatitis. These came about as a consequence of donations in the 70s and 80s, where individuals were not announcing that they were carriers of these diseases, and as a consequence, unsuspecting recipients were being infected. If any of the tests come up positive, a service will generally contact you or make you aware of your next donation. These donated products can be kept for varying periods of time. Red cells are stored in refrigerators at 6 degrees for up to 42 days. Platelets are stored at room temperature on an agitator for up to 5 days. Plasma and cryo products are frozen and can be stored for up to a year. This is the process your blood goes through once you donate it. Plasma undergoes a different but somewhat similar path that will be described in a separate video. Thank you for watching. If you have found this interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.